Hey, good morning, everybody. Thank you for joining. We will get started at 2 after 11. Good morning, everybody, for joining us today for this month's Solution Spotlight focused on SmartShopper. I'm Gabriel Staub. I'm your host today, and I'll be joined by our two SmartShopper expert presenters. From the Zealous team, we have Dave Seacott. Dave is the VP of SmartShopper Sales. And we have Katie Cushman. She's a client performance manager working with our North Carolina clients. And Dave and Katie are here today to help showcase. Dave's jumping right into it. Anyways, Dave and Katie are here to showcase the SmartShopper solution. As you can see there's the agenda, the best practice, an overview, the member experience, SmartShopper outcomes, and then, of course, next steps. Just a few reminders. We will record today's webinar, and we will certainly send this out after it is completed. And don't forget, as always, everybody gets an opportunity to complete the post-solution spotlight survey for a chance to win a $25 Amazon gift card. If you have any questions, please post them in the chat. We'll address them as they come up. Time. So Dave, take it away.
Thank you so much, Gabe. I appreciate that. As Gabe mentioned, my name is Dave Seacott, and I do work at Zealous Sapphire. I'm the Vice President of SmartShopper Sales in the North Carolina area. And attending with me is Katie Cushman, our Client Performance Manager, the person that you would work with and you may work with already on a day-to-day basis when you offer SmartShopper to your clients. Katie, you want to take just a minute to introduce yourself?
Yeah, thank you, Dave. So hello, everyone. Thank you for allowing us to join here. But yes, as David mentioned, my role as a client performance manager, which just means that you're going to have a resource, somebody day-to-day to support you, making sure that we're setting and achieving goals together. But again, just making sure that we're getting the best out of the program and just knowing that me and my team are here to support you on an ongoing basis.
Thank you so much, Katie. Katie, just give me a thumbs up do you see currently the agenda slide? Just make sure I'm okay. Make sure I'm on the same page as the computer and the internet right now. You'll see in front of you folks the agenda for this morning's meeting and call. I'd love to take a few minutes to level set some of our recent research about best practices for care guidance programs. SmartShopper is a care guidance program, and we'll spend a little bit of time researching what we found out about successful and trustworthy care guidance programs and how people look at and define care guidance programs. We'll go through the SmartShopper overview, including the member experience. We'll also look at SmartShopper outcomes across our entire enterprise, as well as we'll drill down just into our experience in North Carolina. And then we'll talk briefly about next steps. As Gabe mentioned, put your questions in the Q&A on the webinar, and folks will look at. I have folks that will look at the questions along the way and interrupt me if necessary. We actually look at the purpose of a care guidance program, and we kind of define it as helping to close care gaps and reduce overall costs. The closing of care gaps should lead to, within a care guidance program, should lead to better and healthier outcomes for your employees' health as well. Or I'll actually mention this right now. I know on this call we've got decision makers and influencers and HR benefits people. I know we have a couple of current SmartShopper clients. I'm kind of speaking to all of you. But when I say closing care gaps, that's as if you were a steward of your employees' health and you want to get them to the highest and best possible healthy outcome, but you'd like to reduce costs along the way and perhaps provide a reward or incentive to your employees to utilize the care guidance program you're offering. So that's the challenge that we face when we look at a care guidance program and all the features and benefits of it. Now, managing healthcare can be a hassle and confusing. And this is about the time where a person like me would have a anecdotal circumstance in their own life where they've been confused and didn't get the right healthcare or didn't have a great experience. For someone even in the industry, I will call out and submit to you that healthcare and getting the right care, figuring out what it costs, can be a very confusing endeavor. And if you look at the bottom part of the screen where it says the number 44%, I won't go through every number on every slide, but these 44% people are the I give up folks. They said it's been difficult to navigate the healthcare landscape, and I just give up. There may have been something I should do, but I'm going to give up. It's not life or death. I'll give up. And then on the right side of that, the 60% number is folks that agree that when they've been described a guidance tool, a care guidance tool, they've said, yeah, you know what, this would help me figure things out and make me be more likely to get the care I need. We choose the wording carefully at the top of this slide, specifically the word trustworthy. We feel that a care guidance program should not be a just check the box endeavor. It should just not be offered to employees to make someone feel good about the fact that they've got a transparency tool or another kind of care guidance program. The guidance program should be trustworthy. And what that means is when we develop a program and we plan to present it to decision makers and influencers and stewards like yourself, we look at three main areas. We look at goal clarity, reporting confidence, and user guidance. And we'll talk about these as a function of SmartShopper and how SmartShopper solves for these needs to get on the way to creating a trustworthy guidance program. But just briefly under these three headings here, the plan, goals, and deliverables should be clear and understandable to everybody involved, from your employee up to your CEO, stopping along the way at HR benefits managers, as well as the finance people and the controllers or the CFOs of the world. The goals should be clear. And the middle section of this slide, when we talk about reporting confidence, I'll call out that with the proliferation of healthcare data, de-identified data available to just about everybody who wants to take a look at it, there is a preponderance of companies beginning to offer guidance services and steerage when they have never been in the healthcare world. To them, it's just data. So understanding the data and how it relates to both the employer as well as the employees really shapes the strategy, and also provides the ability to make on-the-fly changes to make the program better as we go. And then finally, on the right side, the user guidance. When the rubber hits the road and we roll the program out to employees, it should be easy to use, easy to understand. It should be personalized enough that it's relevant to each individual person, and it should lead to measurable improved outcomes. And we'll talk about how that works with SmartShopper in just a few minutes. Now, when I mentioned that we don't create these programs in a vacuum, what that means here at SmartShopper is we've been in business offering SmartShopper for about 6 or 7 years, and we are able to survey our SmartShopper utilizers. We call them members. And so you'll see on this screen where we did member surveys, about 1,100 people. We pulled several small focus groups out and did 7 90-minute sessions with at least 4 participants, and took a deep dive and asked them, 40 or 50 questions, just until we thought they were going to give up on us. And we do partner interviews. We'll talk about the breadth and depth of SmartShopper's partnership across the country. And then we do resonance testing, where we ask people to stack rank 53 different features or benefits and their likelihood to be used and their predicted effectiveness. And so we really get a feel from our current members where they find the strengths and the opportunities for improvements. And we actually see some of the results in front of you. Some of the quotes we've pulled out, some of them aren't pretty, but I won't read each quote, but I can summarize by saying that we've heard that healthcare can be confusing. Folks feel the information isn't always readily available. They feel that they trust their doctor more than anybody else along this process, the continuum of getting and finding healthcare. And then one of the admissions is when we talk with our partners who are in the healthcare industry, almost everybody admits that even in the industry, and I've mentioned this already, finding the right healthcare can be confusing and very frustrating. My personal example is, as I lay my head down on the pillow for a procedure that I get every 10 years, I wonder if the anesthesiologist is in my network. Because one time I got a bill for out of network from the darn anesthesiologist. And a tool and asking the right questions and being bold enough to know the questions to ask would have helped me 10 years or so ago during that. So the slide you're seeing here is, we want to also mention that Zealous and SmartShopper folk within our team, we also look at industry research. We know that big data can be scary, but big data doesn't lie. And there are lots of smart people out there surveying and researching and trying to understand what problems to solve for, perhaps problems that haven't even come up just yet in our new post-COVID, I try to do everything online world. I won't call out each of these statistics. I'll just call out the one on the lower left. Greater than 65% of Americans don't understand what I call simple, basic medical financial concepts, such as premiums, co-pays, and deductibles. Those of us in this industry, and if you're on this WebEx, you are in the industry most likely, in one way or the other. This is sort of just a clarion call to let's strive for continuous improvement, and take the available information and try to listen to our members and our partners and all the other constituents, and make things better over time, slowly but surely. So taking our member surveys and our industry research, as well as our SmartShopper experience over time, we've kind of pulled out some common themes, and there are 3 of them. These things seem to come in threes. I'm going to share 3 of them with you, and how we think that we've worked to develop in conjunction with Blue Cross of North Carolina and our other Blues partners, a program that begins to meet the needs of some of these 3 themes we've seen come out of our survey and research. So finding number 1 is 35% of members ranked their trust in payers as positive, compared to 52% for providers. Naturally, we trust who we see and know, and the doctor we've gone to for years. And maybe it's not the doctor we trust as much as the person at the front desk who refers us to the place for an MRI or for a colonoscopy or for a planned surgery like carpal tunnel surgery, for example. And the insight that comes from our research and our surveys is that trust can be improved with a humanizing experience that treats members as partners. Humanizing means people see the relevance of the care guidance tool that they've been asked to take a look at. The steps for the tool are simple and understandable. And then there's a human element to the guidance as well. Can I talk to a real person if I need to? So that's where the trust can be built with a humanizing experience. And building trust is a long-term endeavor. We understand that brands like Delta and Target and Visa and Amazon have built trust. Folks understand what they're going to get when they access these companies. By and large, these brands, these trusted brands are easy to use, and they're going to give you a predictable experience. It may not always be wonderful, but it's predictable. And most importantly, when you utilize a trusted brand, the outcome, you expect a worthy outcome. You have you're going to travel somewhere, or when you use your Visa card, you expect and you trust that what you see the price of the item, your card gets swiped, that amount will be deducted, not more, not less, from your account that will be added to your Visa account. So when we look at a care guidance tool, we have in the distant past, we focused on activities like getting people to go to our website, getting people to shop, getting people to read our engagement materials or engage with us and to learn. And we understand the top right of that driving action and building trust is folks are looking to get better, healthy outcomes from any tool that they use. Yes, they like the reward. Yes, they like the good feeling they get for saving themselves some money and maybe even to save their company some money. But the nirvana, the bliss that people are after is better health through healthier outcomes. So that's a core function that we always have in mind as we build and rebuild our SmartShopper tool. The second theme that came out of our research was the level of pain. Yes, there is pain in this process at key points within the consumer journey can vary. I won't go through left to right on the timeline. And by the way, you will all get a copy of this presentation when we're done, and you can take a look at it piece by piece, and feel free to follow up with your Blue Cross of North Carolina person with any questions about the presentation, and I'll get the answers back to them. But the fact that the level of pain at key points can vary and can peak, quite frankly, under insight number 2, at 2 different points. Members articulate a sense of dread due to lack of clarity and control when it comes to the cost of medical procedures. And when we drill into this process and where they find out information about cost and their choices, their options, i.e. the clarity part, we find out that the stage right before receiving care and just after receiving care produce the highest levels of member frustration. So knowing the coverage, your coverage options, your provider and facility options, and the range of what this might cost me ahead of the procedure, and understanding statements and bills, having less surprises after the procedure, are 2 areas that we have built SmartShopper to address. And then theme number 3 that came out of our research and surveys is that satisfaction drops at key points in the consumer journey. Once again, won't go left to right across every point of the journey. Just look at where those 3 lines dip. And under finding number 3, regardless of type of procedure, could be a simple MRI, could be cataract removal surgery, could be anything above and in between. Satisfaction drops in 2 key places: estimating cost and reviewing bills. And our insight is that better preparing members to understand costs upfront can reduce significant drops in member satisfaction. There's no magic or mystery that satisfaction drops at the 2 points of confusion and lack of clarity around costs and options and choices. These key insights can be sort of summarized by the 4 squares you see in front of you right now. Some folks from lack of clarity end up going outside the network, unbeknownst to them, or really unbeknownst to their doctor's office. When they say, hey, is this, you're referring me someplace, are they in my network? And the person at the front desk says, yes. The person at the front desk of the doctor's office may not be the most qualified person to make that call or make that decision or to share that information. And a simple to use, easy to use care guidance tool could clear up that confusion. The lack of confidence in what something's going to cost in the procedure, that can lead to care avoidance. Leaving the healthcare system entirely. Who among us, and here's where if we were in person, I'd ask, who has ever used Dr. Google? Dr. Google is wonderful, but there's no accountability or responsibility on the part of Dr. Google. So we want to keep folks inside the healthcare system, and we want to provide them the tool that gives them the confidence to do that. So we're going to step from sort of our key findings and what we think works well with a trustworthy care guidance program, and drill a little bit into the SmartShopper program, how the program works and how we've developed it and how it works on an individual member level. So as I go through the next slides, we're sort of filtering down into SmartShopper. I appreciate your patience with me. As we move from insights to action under these 3 clarion calls, needing clarity, needing confidence, and needing guidance, we understand that a care guidance tool needs to provide transparency and education, key point here, without being overwhelming. I did use a competitor's tool at my last employer, and when I was looking for an MRI facility within my network, within 30 miles of my house, the person sent me over 100 choices in an email, and that did not help me that did not provide the clarity that I needed. And then when I started calling one or two at random, the first two that I called were no longer accepting new patients. A very poor, underwhelming experience. So we need to return information that is not overwhelming, and we'll show you this in just a few minutes. There has to be a confidence factor. The information at people's fingertips to let them easily compare options has to be accurate. The care guidance tool has to be integrated with your own medical plan. And SmartShopper is deeply integrated both with network, with cost and claims, with Blue Cross of North Carolina and our other partners. It's real-time information. When we do a search, there's often a 5 or 10 second delay while we pull the most recent information and display it to you. And then on the guidance part of it, the guidance that's provided has to be relevant. It has to funnel down from complexity to consistency, and it has to be backed up by experts on standby. And we'll talk about our member experience and how that we have live persons at folks' fingertips to call and talk to when they use SmartShopper, which is a key differentiator. Now, before we jump into SmartShopper, we love to use the TurboTax example. If I were in person and in front of you, I would ask you to raise your hands to see who has used specifically TurboTax, and then who has also used a TurboTax-like tax preparation software like TaxSlayer or H&R Block. Many people have used TurboTax or are familiar with it. And the TurboTax folks they got it really early. They solved a complex, relevant, important problem, accurately preparing and submitting my tax return to both the federal government and my state. They solved it by taking reams and huge amount of data and putting it into a linear question and answer process. One of the things they did that was magic, and I read a case study on TurboTax, is when you use TurboTax in the upper right corner, it may still be the upper right corner, they show you a running tally of your refund or your taxes owed. They provide relevance and clarity and basically cost information as you go. And you're able to respond accurately to questions. You're able to toggle back and forth and look at the effect of different responses on your tax liability or your refund, if you will. That third bullet, they democratized a frustratingly complex process, and they make it clearer. I will call out that they do provide guidance, personal guidance through folks along the way, but you cannot just pick up the phone and call a TurboTax rep. You do it through chat and through scheduling appointments with an additional cost most of the time. There's no additional cost to use SmartShopper's personal assistant team or our care concierge group. We'll talk about them in just a minute as well. So please meet SmartShopper. SmartShopper is a service that helps members find and get the care they need. We do the legwork. We gather the information, the relevant information, and we provide to help make decisions clear and simple. We save folks time and money by making things simple, by providing a TurboTax-like experience. We do work with 17 payer partners across the country. So we have a nationwide footprint, and we do serve over 6 million members currently, right now. Some of you on this call, on this WebEx, do represent folks that are part of our membership. So thank you. Thank you, by the way, for your trust. We make decisions clear and simple. We limit the rewardable or the incentive eligible procedures to about 200 or so, give or take. We make the cash incentives be between $15 and $1,000. These are obviously for simple procedures where the cost range is more narrow. The reward is on the smaller side. For more complex, plannable elective procedures where the costs can range widely, we have a larger incentive or reward to get folks to take a look and pay attention to an alternative, perhaps in-network, good quality provider. When folks use the SmartShopper system to search and to get information about providers and facilities for these 200 or so different plannable or elective procedures, they end up knowing the providers and facilities that are in the network within a short driving distance, from their zip code, and they know the range of costs, and they know what things would cost out of pocket for them, based on the fact that through our integration, we have their network and the network, as well as their specific plan design information, has come over from Blue Cross of North Carolina over to SmartShopper. By showing accurate information up front, especially at that right before the procedure or right after the procedure, we reduce billing anxiety and slowly build up trust. It doesn't happen overnight. It takes, utilization and over, second and third utilizations, answering questions accurately, and then seeing the reward show up to you. We'll go through this procedure, but to see how the reward check show up in your mail after you've gone on to the SmartShopper website and done, quote, shopping, unquote. So we create confident healthcare consumers through not just the personalized cost information that I talked about, the accurate network information, but by providing quality metrics. And so the quality metrics, the first quality filter we have is that SmartShopper will only return search results that are in network. And in network means that the good folks at Blue Cross have a stringent value proposition that each of the providers has to offer. The right combination of cost range plus quality outcomes. And that is why it's very important to understand if a provider was in the network last year, they may not be in the network this year or this month versus last month. And so an accurate integrated care guidance tool is very important. We do ask folks after they've utilized a given provider or facility to rate their experience on a scale of 1 to 5 stars, and we'll provide, it's a Yelp-like rating experience, so it's as accurate as Yelp can be or may not be, but it's a wonderful way for folks to have a part of the quality metrics that we provide. We will call out distinctions, awards, or affiliations for a provider or facility. So that will all be at a person's fingertips to click on and take a deeper dive into, or to call SmartShopper about. What you see in front of you, and we're going to take just a minute to leave this presentation and go to our SmartShopper member portal. But the launch point to get to the SmartShopper portal is on the Blue Cross of North Carolina members Blue Connect homepage. So if I were a Blue Cross of North Carolina member and I signed in to Blue Connect and my company offered SmartShopper as a benefit, not all companies have this. You have to elect to offer it and provide it to your employees. That member, as a member, I would see a Earn Cash with SmartShopper tile, and with just a little bit of a blurb with a Shop Now, click here, please button. And when you click here, you are brought over via single sign-on to the SmartShopper website for Blue Cross of North Carolina. So I'm going to just give me a minute. I'm going to stop sharing my screen, and I will fire up our member portal demo site, and then I will reshare my screen.
Hey, Dave, sorry to interrupt. I think we have a question by Mandy. I'm not sure if she has a question or not. Mandy, did you have a question? You can type it in the chat, or you can mute. Looks like Tammy had one maybe too.
And
Tammy,
Gabe, while
question?
you're pulling out those questions, let me know if you see the member portal homepage that I've shared.
I do see it. Thank you.
All right, thanks.
All right, Dave, go ahead.
Okay, interrupt me, Gabe, if questions pop up and they're relevant to what I'm talking about, or we can wait to the end as well. It doesn't matter to me. Folks, you're seeing, and I'll spend one of the next steps I'll ask you if you're interested in SmartShopper is to let me give you a full-blown member portal member experience demonstration. I'll spend about 5 minutes, maybe 6 or 7 minutes on our member portal here and now, and go back to the rest of my slides. But I'd love to take what you see. I take a few minutes right now just on the on the home page. And so if you're an HR benefits team member, or you're a trusted advisor, and we do a member portal demonstration, just know that this is what I would show to folks. When we do an open enrollment meeting, we take a couple screenshots and show it to your employees, but we don't overload them with information during an OE meeting, honestly. So on the member portal homepage, you'll see that because we are integrated and we get eligibility information sent from Blue Cross of North Carolina over to SmartShopper, that we know that, my member name, this is Juanita Ayadi, total made up person. But we also know, very importantly, we know their network, and we know what their home zip code is. And obviously this person's home zip code is 27302, Mebane, North Carolina. But you could toggle that zip code to a different location for example, my daughter went to school about 30 miles south of where we live. And if we were searching for her, I would change to her zip code for where she goes to school. You could change if you live in Raleigh, you could change it to the High Point University zip code, for example, for your college bound child or student. But we default to the zip code that is stored on the Blue Cross of North Carolina system. And so when we typically search between 15 to 20 miles of somebody's zip code, we'll talk about why that is in just a minute. And on the homepage, you'll see that there are different tiles to click on to get further information. Most folks, when they come into our homepage for the first time, it's because they've been encouraged to search for, I'll say, one of the common things that people search for, we'll say colonoscopy screening. And so I type in colonoscopy, and the different choices come up for, is it diagnostic colonoscopy? Is it just a screening? So you type in colonoscopy screening, and we'll bring up search results within I think it's within a 15-mile radius of the Mebane zip code. And you can see as we look top to bottom, there's a real quick description of what a colonoscopy screening is. And you'll notice that we have an 877 number called out. This is a dedicated number that will take you right to our personal assistant team. And it's dedicated only to Blue Cross of North Carolina members. So if someone gets confused, and this number is splashed on just about every screen we have, I'll talk about our personal assistant team in a few minutes in more depth, but just know that folks that want a total online experience, they can use their phone, or they can go to our website through the Blue Connect tile. They can totally do everything online, or they can stop and they can totally do everything by calling our personal assistant team. On the right side of the search results is the estimated costs for a colonoscopy screening within this members network. And you'll see they run from $1,100 to $2,100. These are all in-network providers or facilities. And there is a chance for a member to earn up to a $500 reward if they use somebody on the lower end of this cost range. Knowing that these are in-network, good quality providers, this is when a person might say, hey, my doctor recommended I go to XYZ place. Just for kicks and giggles, I went to the SmartShopper thing and searched, and I asked my doctor if I could go to a different facility, this UNC facility physicians facility, for example. And my doctor said, yeah, they've sent a person, 1 or 2 people there, and it seemed to work out just fine. So go ahead. No one is forced or coerced into using SmartShopper or using any of the search results. It's a question I get every now and then. We just know to encourage folks. We just give them information, let them know their options. And you can see on this screen where we've had, and this is a demo site, so this is all dummy information, but we've had people rate the facilities or the providers. We call out their affiliations or their blue distinction of designations if there are any. We call out any additional procedures that may take place from this doctor or this facility. So I will typically I will look through a few more searches. I'm going to change the zip code just to I'll just change it to the Charlotte zip code. Let's see, Charlotte 28201, and we'll do a different search. Oh, well, I guess we'll do the same search. How's that for a colonoscopy screening? And see what comes up. So obviously it's a fairly common procedure. So there's a bunch of different facilities. I could show you one where there was 1 or 2 rewardable facilities or providers that come up, and then the rest of them you don't get a reward, but the quality and the cost information is still there as well. I would take a deeper dive when we did this one-on-one with your specific, zip codes for your employees, etc. I'm going to go back just to our homepage, and I'll just call out one more thing. Folks ask if we have, how can I look and see if I've done a search or when I last did a search? And next to a person's name, we have their profile. And if this is a very commonly accessed screen, and you can look at your search history. And I'll call out just the information here. We under search history, we list out the procedure, the search date, and we've assigned this search incidence a confirmation number, because once someone has searched, if they go get the procedure anytime in the next 12 months, and technically we search for 13 more months, we match up claims received to prior searches. And if we find a match, we automatically mail out a reward check if applicable. So folks will say, hey, I did a search. I can't remember when I did the search. Do I need to do another search? I kind of delayed. I dragged my feet. Now it's been 6 months. They can see their searches. They can call us and ask us about that. And the search will stay on our records for the next 13 months. So I usually stop here and kind of go back to my slide deck. If there are any questions on the member portal, please put them in the chat and I'll answer them. And I will just I'm going to go back and share my screen.
Hey, Dave, we do have 2 questions that came in.
Go ahead.
All right, the first one is from Tammy Bradford, and her question was the estimated cost, including the smart cash. I think she was asking, is the estimated cost, is the smart cash amount taken away from the estimated cost? I think that's what you're asking.
But I've had this question before, and I'll answer it this way. So folks ask, how does the reward get factored into the cost to the employee? And the short answer is it does not. The range of costs, the actual cost for the procedure, will be run through the system and adjudicated and show up on the EOB. And either the employer or the employee, obviously based on their deductible or their how their plan works, will pay for the procedure. And then separately, if applicable, a reward check is mailed to the employee. So the employer, if it's a self-funded situation, the employer has benefited from the lower cost, and a portion of that savings is then taken and sent to the employee as a reward. So it doesn't change the overall cost, but it does incent people to use a lower cost in-network facility or provider, thus saving the employer or the payer money, and a portion of that savings gets allocated as a reward check. Gabe, do you think that addressed that question?
I believe so. We'll see if Tammy puts some other comments back in.
Okay.
So yeah, she did. So if the estimated cost was $882 as an example, did that
Yes.
include the $500 in smart cash?
No, it does not. No.
Okay.
I mean, and for $800 example, the reward would not be $500. It might be $80, if you would.
Yeah. All right. We have
Gabe,
another. Yeah, two
go
more
ahead.
questions, Dave. Sorry.
No, don't worry.
So question came about colonoscopy screenings, Dave, and this is a typical one that's shopped in my experience working with groups. But why would the colonoscopy screening cost anything? Isn't that covered at 100% since it's a preventative benefit? Dave, I just said to her that in some cases, yes. However, if I get my colonoscopy, 30 miles down the road, it may be more expensive and still be at the same quality or less. But Dave, you can go into that question.
Yeah, and Gabe, that's a great point, a great call out. And Gabe, correct me if I'm wrong, somebody pays for the colonoscopy. It doesn't cost the employee anything, and is that correct?
Yeah, the preventative screening wouldn't be paid by the member, but it's the group obviously might be charged.
Yeah, so
Yep.
to incent someone to use a lower cost colonoscopy screening facility, the benefit to them might be indirect. They may not care one bit where they go. Maybe the reward would get them to go to a lower cost facility, and that benefits the employer. That you called out that as an example. Person on the WebEx, thank you. That's a great kind of nuanced situation and scenario.
Yeah, and I guess
Thank
I
you.
would just add to that as well, is that even though you may not have to pay an out of pocket for that visit, if you do choose a lower cost, you could potentially still get incentivized for choosing a lower cost facility. So to you, you'd potentially be getting a reward check.
Tell me, Gabe, if we have more questions or if you'd like me to keep going. Look like we're at the 3/4 of the hour mark. We have 7 or 8 more slides, but they're kind of quick ones. We can stop and answer questions or keep going. You tell me.
Yeah, Dave, keep going. We'll try to address them in the chat directly.
All right, and just confirm you see our lovely 4 people from our personal assistant team on the slide right now. Is that right?
Yes, we do.
Okay, great. I actually had called out our personal assistant team, our care concierge team earlier. I won't spend a lot of time on this and them, but I will point out that one of our key differentiators from our competitors is that we have invested in and maintain a group of phone representatives, if you will, care concierge folks, we call them the personal assistant team. You can call them during regular business hours, Monday through Friday. I believe it's 8 to 8 East Coast time, and then on Friday we let them go home at 6. They offer all the same guidance that our online tool offer. And I will submit to you, the first 1 or 2 times somebody uses SmartShopper, having somebody to call and run the thought by, I'm thinking this, what should I do, makes a huge amount of difference when you roll out a plan, especially in the first year the plan is offered to your employees. So I'm so happy that my company continues to support and make this and call out this differentiator, and we're not going to the chat GPT solution where you ask a question and the answer is almost on topic. These live folks make a huge difference, especially early on when SmartShopper is offered. I'd love to go on about them, but I'm going to move on in the interest of time. I have a few slides that will show some of the outcomes, some of the numeric, some of the quantifiable outcomes for SmartShopper. And looking back at just the year of 2022, and this is across our full entire enterprise, you can see the numbers that we've achieved through savings just in the year 2022. Note that we offer SmartShopper across the country. And yes, folks you can live in North Carolina, or your company can be based in North Carolina, you can live in Michigan, and you can still utilize SmartShopper. That's the power of our integrated solution with our Blues partners across the country. As a matter of fact, we have that happening right here and now with current SmartShopper clients of Blue Cross in North Carolina. Not everybody lives in North Carolina, as great a state as it was. I enjoyed my 8 years in Fuquay Arena. I call out, one of the things I call out on this slide before I move on quickly is the satisfaction numbers across our enterprise. Folks, if you know what Net Promoter Score means, we get an 87 Net Promoter Score, which is super, super good, of who would recommend SmartShopper to a friend. And a 94% of SmartShopper users think the program is valuable, and they appreciate that it's offered by their employer. Just a little bit deeper dive on our 2022 numbers across our enterprise is that we recognize that female household members are shopping. Those are the household members that will utilize SmartShopper first and foremost, more than anybody else. We also saw a 20% increase in shoppers over the age of 45, from 21 to 22. MRIs remain the most shopped procedure. But the other procedures are catching up as we engage and educate, and tools like SmartShopper get rolled out more and more. Folks don't want to travel a long distance. 80% of the shoppers drove less than 20 miles for an incentive facility. But conversely, shoppers don't need big rewards. You can see that the majority of the rewards, were under $50. Folks don't want to spend a lot of time finding out the answer or driving to a better facility, but they don't need a huge reward to do something better for themselves. I love that. We'll act in our own best interest when it's convenient, first and foremost, and we get a good feeling by doing that. Not just the dollars count, quite frankly. Over the 6 years that SmartShopper has been offered, you can see the program to date across our whole enterprise numbers. We'll send you this slide deck. You can actually look at the performance report that we just issued, program to date and 2022's performance reports. I'm going to advance just in the interest of time. Our numbers for just inside Blue Cross of North Carolina, for just our partners that have come to us through Blue Cross of North Carolina. And these are folks, the majority of these folks do live in North Carolina, but there's a great subset that live across the country. Program to date, since 2019, when the program was launched, we've saved over $2.8 million in claim savings. That includes cash incentives. So that's net of cash incentives paid out about $293,000. The average claim savings per incentive paid is $2,011. That's a really a great high functioning care guidance program, providing engagement and healthier outcomes to members, to your employees, but also saving the employer some decent money. So I will call out one last thing. This is my last slide. Next steps, in addition to getting a deeper dive into our member portal and answering all the questions that come up from looking at how the program works, we are actually able to run a potential savings analysis with your permission. Get a hold of your Blue Cross of North Carolina client strategy person or your account executive, and we'll look at the last 12 months of claims data and identify what the potential savings could be, and we'll break it out according to procedures. And that is a great piece of information to make a decision whether it's worth it to take a deeper dive and look at SmartShopper. Spoiler alert, usually it is 9 out of 10 times. And then right behind that, the image of our savings analysis, our performance report, we generate that each month for any SmartShopper utilizers. And Katie Cushman, who joined us, is available to kind of walk through and look at the results and strategize on the best way to lead to more engagement and even better results. So I'm going to stop here. It's time for questions. Well, I will ask Gabe if there's any questions we should address here and now. Let me know. And I also appreciate, Gabe, you and your team answering questions on the fly. I totally appreciate the opportunity to speak to everybody in the call today and wish you all the best.
Yes, Dave, we do have a couple additional questions if we can answer those. All right, so we have a question. How accurate are the out-of-pocket costs shown? And is there any recourse if services are higher than shown in the SmartShopper app?
So great question. We will display the out-of-pocket estimates based on the most recent information that has been shared by both Blue Cross of North Carolina and the national cost people from the Blues Association. We recognize that is accurate in 98, a high 90% of the time, but occasionally the costs have changed and the data hasn't caught up hasn't flowed through to our SmartShopper program. So we recognize that 100% accuracy is probably unachievable in a moving world, if you will. But by and large, the data, the range that we give is accurate based on the network information and the most recent cost roll data, quite frankly, that we've received.
All right, thank you, Dave. One more question. All right, what happens if the employee uses SmartShopper, gets an estimated cost, but they receive a bill that's higher than that amount? Will SmartShopper contact the provider?
So this is an example that might happen if somebody shops in March and gets the procedure done in September or October, and the cost for that particular facility has changed in between. That I'm just going to say this, that's on a case-by-case basis. That does happen occasionally, and we do not want disappointed utilizers of SmartShopper. The example that I would like to call out is if we estimated the cost range was 500 to 1,000, and we said your reward if you used the lower end would be $50, and it turns out that the actual cost was $750. We would love to work with you as the member and your HR benefits team. Number one, to see where the break was in the cost data, but also to see if you could be rewarded based on the actual cost. You might imagine that our tool can't force a facility to provide less, to bill less if they went through the proper channels to change their cost range. But that would be on a case-by-case basis. It does happen occasionally under that scenario I provided.
And then we did have a question about costs of the program. I know we want to get everybody in contact with their account management team to discuss pricing and next steps. Dave, is that your preference?
See, you know what I would recommend, there's a per employee per month, very, very modest charge based on the size of your company. Get a hold of your account executive. If you are a self-funded, or you represent a self-funded client, you know that all of that stuff is provided for you through your Blue Cross connection. And I know the range, but I'm hesitant to say it publicly because I'll be wrong at some point based on your relationship. Is that fair, Gabe, to say?
Yeah, that's fair. Another question, Dave, if I'm out of state, if I have a member who's out of state, can they still use SmartShopper?
Yes, absolutely. It happens every single day. That is the value of being part of the Blues Network, quite frankly. You can go anywhere in the country and know what something was going to cost you within a range.
Dave, you talked about TurboTax, so we have questions about taxes. What are the tax implications for members who receive rewards?
Okay, yeah, TurboTax, thank you. So rewards are taxable, and we will note that on a member's reward. When they get a check, they have a stub with it, and we'll note that they're responsible for reporting any income they get to the IRS. For employees that get more than $600 in rewards in a given year, SmartShopper will mail them a 1099. So that's if the employer asks us to do that. That's one of the ways we get the tax reporting out to folks. We'll mail them a 1099. We do offer a service if the employer is a bank or an accountant's firm. They'll say, no, we want to W-2 everybody their SmartShopper rewards. So we do have a program where we probably do this for 1 or 2 clients in North Carolina, where we'll send them a monthly file for all rewards earned, and that employer would report all income from SmartShopper on the W-2. Probably the best mix of accuracy and adherence to IRS rules is to let SmartShopper mail out a 1099. Let us own that process for anybody that earned more than $600. Does that answer the question, Gabe?
Yes, sir.
Okay.
We have just a few minutes left. I think this one's important to ask. Are there any costs to the employer for the services? So obviously, yes, but Dave, I'll let you go into that.
So there is a per employee per month monthly admin fee that you'll pay to Blue Cross of North Carolina if you're a self-funded client. And other than that, there are no regular costs. Occasionally, we'll have a client offering SmartShopper that wants us to do. We have a regular cadence of engagement materials where we'll mail out a postcard or provide information. If somebody wants us to mail something I'm making this up, something once a month to everybody, and it's outside of our normal engagement strategy. On a case-by-case basis, we may talk about sharing that additional engagement costs, but there are no other additional regular costs to the program. The sort of parenthetically, I will say the incentive, the rewards are funded by the employer. And so if I go online and shop and I go to a lower than average cost in-network facility and my reward is $250, the reward comes from you, the employer. And then at the end of the month, we'll say, hey, CCOT saved you $1,100 by going to get his colonoscopy here. You paid him $150 to do that. Your net savings was $850. So that's not really a cost of the program, but it is something you'll pay for along the way. So I always call that out as well.
All right, Dave and everyone, thank you for your attendance today. If we did not get to your questions, we will certainly address those either individually, offline, or as a follow-up email with all of the information that we will send out later within the next few days. Just a reminder, if you joined late or had to jump early, the webinar is recorded and we will provide that in a follow-up email. Please make sure you take time to complete the post-webinar survey if you want a chance to enter that raffle for the $25 Amazon gift card. In September, we will be hosting our next Spotlight Solutions webinar, and we will be spotlighting Blue Cross's ancillary solutions. We are still finalizing details in terms of dates, but you will soon receive information about that. I put the link in the chat if you want to just go ahead and pre-register. So with that, I want to give another thanks to our presenters for joining us here today. I hope everyone has a great rest of their day, and we look forward to seeing you next month. Thank you, everybody.